Hello, and welcome to Healthier Ever After with Grace and Michelle. Here at Healthier Ever After, we discuss the health and wellness journey, bringing up important topics while striving to live our healthiest lives. We'll bring in special guests each time, experts who can answer your questions in real time. Drop your thoughts and questions into the comments section, and let's spark a healthy conversation together. I'm Michelle, an expert coach with Teladoc Health, specializing in health and wellness coaching and working within our diabetes, hypertension, and weight management programs.
Hi, Michelle. I'm Grace. I'm the Director of Solution Strategy and the subject matter expert for all things chronic condition with Teladoc Health. I'm a registered nurse by background and also a certified diabetes care and education specialist.
Awesome. So today we have two guests, which is something special for our last live stream of the year. First, let's introduce Dr. Carla Chonillo. She received her MD from Windsor University School of Medicine. Hi, Dr. Chonillo. How are you?
Hi, Michelle. How are you today? Hi,
Good,
Grace.
good. Thanks for
Dr.
joining
Chonillo.
us.
It's good to be
Doc-
here.
Awesome. Dr. Chonillo trained at Ascension St. Mary and Elizabeth Medical Center in Chicago, Illinois for her family medicine residency. Dr. Chonillo holds certifications from the American Board of Family Medicine. She's been practicing for 8 years and has a special interest in chronic disease management, so things like diabetes, hypertension, congestive heart failure. And she also enjoys long-standing relationships with her patients and always tries to help them to the best of her ability. Thanks for joining us.
Thank you.
And of course, Miss Marissa Kelley. How are you, Marissa?
Hi, Michelle. Hi, Grace.
Hi, Marissa.
Hi, thanks for joining us. Marissa has over 20 years of experience as a registered dietitian and has been working as a Teladoc expert coach for the past 8 years. Her motto is make the next best choice, which I love. In her free time, she enjoys yoga, reading, and can be found on a baseball field cheering on her two boys. So, the both of you, welcome to Healthier Ever After.
Thank you.
Thanks for having me.
Yeah.
Yes, thank you. So let's get to it. Today, we're going to be talking about the unique wellness journey of women. It's important to reflect on our evolution, our journey to health, but sometimes with women, that looks a little different compared to men and compared to the research that's available. Dr. Chonillo, what are some instances where we see this being true? And can you share experiences where we would see this type of discrepancy?
So I think overall, sociocultural factors have really impacted wellness in terms of women. I think that nowadays, with everything that's going on and the fact that, women are now a lot of the time standing up and saying, you know what, I want inclusion too. And I think that also impacts, wellness. I would say, for instance, that biologic sex, it impacts the way that we, for example, diagnose diseases. Because, for example, heart attacks present differently in men than they do in women. We find, for instance, that medications are metabolized differently, by men and women. And some of the places where we see these discrepancies, believe it or not, are in research studies. I mean, there is one in particular that I read recently that it shows that, women are not sort of like discouraged, but, men are usually the test subjects just because of the fact that it costs more in order for women to be, part of research studies. Also, for example, we see this in advertising. We see it in the way, for instance, that, certain diseases are advertised. I'll give you a perfect example. I was watching Shogun the other day on Hulu, and a ton of ads popped up, regarding like low testosterone. And I was like, where's, the women's, diseases, things that women, need to worry about. So yeah, like I said, I caught a couple of commercials on that and I was like, interesting.
Shogun is such a good show, by the way.
I'm trying to get caught up, so because I heard
Okay.
it was very good, but yeah, I'm making my way through it.
Oh my gosh. That's awesome. Marissa, anything to add there?
I would agree. I've been listening to more podcasts recently, and the amount of research that goes into men's health versus women's health is phenomenal. It's really discouraging to hear as a woman, and even more so that after pregnancy and the research done in our younger years compared to what's happening in perimenopause, menopause, older years is there's like a third of the research. It's just not there yet.
Which is a good thing to bring up, honestly, because one topic that's made its way into mainstream recently is menopause, right? The inevitable change of life that comes typically in our 40s. Marissa, let's start with you. What do we know about this stage of life, and what do you think has become, and why do you think it's become such a hot topic now?
I think it's such a hot topic because it affects so many women. Perimenopause and menopause affects 6,000 women per day and 2 million per year. And for some, these changes start happening in their 30s. So perimenopause can last a time frame, and the menopause is usually around 10 years. And then postmenopausal women are 1 year following their last menstrual cycle. So that average age is 51. And I think there's a big movement to normalize this transitional life, to be heard, to be supported. We know that what was working when we were 30, start exercising a little more, cut back on your eating, make some cutbacks in alcohol, and you lose those 5 pounds. You can do all of those things in your mid 40s, early 50s, and those changes no longer equal results. And I think overall women are just really frustrated with that and no longer accepting that it's just a normal transition.
Yeah. I mean, thinking about it too, you said some staggering numbers there. And I think, looking at it one time that 1/3 of women are technically in our life, right? We're going through menopause or perimenopause 1/3 of a woman's life. I mean, that's a crazy stat. That blew me away. But yeah, Dr. Chonillo, anything to add there?
Nowadays, like perimenopause and menopause are just being normalized so much more. I mean, back in the day, like I remember when, my mom went through it, it was synonymous with I'm old, and nowadays it's, us women, we're just embracing it as, what, it's another part of our lives. We've got so much more to live after that. So I think that nowadays, with women, us living longer as well. It's, not synonymous anymore with being old, but I think with more so just part of another stage of our lives.
100%. I know there's been like a lot of celebrities. One that comes to mind is like Halle Berry. I know she's been like on this campaign to talk about menopause. I mean, we're still vibrant. We're still full of life. We still got a lot going on, right? We're not old. We're not spinsters or, whatever like the old words used to be.
Right.
But as we all know, Teladoc Health provides amazing support for chronic condition management. We have programs for diabetes prevention. We help support those with living with both type 1 and type 2 diabetes, with high blood pressure, hypertension, weight management support, and also mental health support. Today actually happens to be World Mental Health Day. So increasing awareness, prioritizing our well-being is so important. This is a reminder to do that, to support one another and to help break the stigma surrounding mental health. We've seen great success with our members being able to monitor, to better manage their chronic conditions and their mental health in a unified experience. Dr. Chonillo, how does menopause affect women who may be living with a chronic condition like the ones I mentioned? And with that, some of the changes that you think that people should focus on? I know like weight loss tends to be a little harder going through those changes. Is there anything else that we should be keeping an eye on?
Yeah, so first of all, I just want to give a big shout out to chronic care management. I always, encourage my patients with, chronic care conditions, especially diabetes, like high blood pressure. I'm like, take advantage of these services. They're fantastic. But I have to say, one of the big things that going through menopause is that, obviously we all know that we lose that estrogen. And estrogen is a real sort of big protective factor when it comes to, our cardiovascular health. That's, for instance, why you see that, women having heart attacks at a younger age, less than 55. It's something that occurs, but is overall, rare. So once we go through those sort of menopausal changes and our estrogen starts to drop, we do lose out on those protective factors. So our cardiovascular risk actually increases. So I think that, with going through menopause, you've got to know what your blood pressure numbers are, what your cholesterol numbers are. And then overall, I think just maintaining like a healthy weight, maintaining a healthy diet. If you've been a smoker, definitely, consider quitting at that point in time. And then, I mean, overall, mental health is one of those things that, we all know that we need to take care of, but something that's, not always addressed. And depression is actually diagnosed in that post-menopausal transition period in 2.5 times more women than in the premenopausal period. So it's just one of those other things that, we women have to watch out for is our mental health.
Absolutely. Yeah, so important. It's often so difficult, I say, to try to focus on your physical health without addressing your mental health needs as well.
Exactly.
Marissa, what are your thoughts around that?
Well, I love that Dr. Chonillo brought up the mental health aspect. I have also recently learned we have tons of estrogen receptors through our entire body, and many of them are in our brain. And when those levels diminish, those receptors kind of dim. And when they dim, you get that brain fog, that depression, the anxiety, all of those side effects that are happening are due to the lack of estrogen. I can focus as a registered dietitian on the lifestyle changes. We know, like step one, nutritionally, an anti-inflammatory diet can be really helpful. So lots of fruits and veggies, getting good whole foods, including lots of fiber. So the recommendation is actually 25 to 35 grams of fiber per day. And the average person gets 12. So really looking and focusing on fiber can make you feel full longer, gives you all of those good gut health and nutrients we're looking for, and a high protein diet. So protein makes us feel full and stay full longer. Including it at all meals, especially first thing in the morning to get you going for the day, and limiting sugar. So I've recently seen 25 grams or less sugar for the entire day. That is a very small amount. So like if you're adding any sort of chocolate, wine, pastries, sweets, it's all going to very slowly creep up. If you're putting a little, sweetener in your coffee, and you're having 3 cups, you might be at your limit. So really looking at the sugar that's added into our day. And supplements have a place here. So looking into magnesium can help with sleep, depression, and anxiety. Turmeric has lots of anti-inflammatory benefits. And supplementing vitamin D, we're often pretty low. And depending where you live, you might really be covering up in the winter and putting sunscreen on in the summer. So you're not getting the vitamin D that your body needs. So those are some of the nutrition factors we can kind of specifically pinpoint.
Can we keep the chocolate and just do like dark chocolate? Is that better? Is that like a healthy swap?
I'm allergic, so I don't know anything about that.
Everything in moderation.
Everything in moderation. I have a little dark chocolate every single day. So yeah.
Love that.
Yeah, and it is anti-inflammatory, but
yes, it is.
Mm-hmm.
And lower sugar than milk. Milk
There you go.
chocolate. Yeah.
Mm-hmm. Now, that's great information. And if you think about it too, some of the things you mentioned, Marissa, I mean, increasing your fiber intake, aiming for protein at meals, these are things that we try to instill in people even before perimenopause, males, females. I mean, these are part of a healthy diet. So trying to instill these at a younger age is really beneficial too. But that's a pretty wild stat that we only get about 12 grams of fiber. That's interesting. But with that, what are things that women can do to manage the physical and mental challenges when it comes to menopause? I know we touched on, the mental aspect of it a little bit, but I want to hear from you. Let's go with Marissa. What advice can you provide for our audience?
I think educating yourself. So knowing and understanding what is happening in this transition period can be very beneficial. Estrogen's a hormone. So as that goes down, it affects other hormones. Those hormones have to do with how we feel hunger, how we crave foods, how we lose muscle as we age. So physically making sure we're doing lots of activity, as active as we can be, really using our resistance training to maintain and build muscle. Even if it's your own body weight, yoga, resistance bands are a great way to do that and incorporate it. And also to optimize your sleep and your stress management. So it's this whole lifestyle approach. It's not just one thing that you need to be doing. It's really overall, how are you managing your entire health?
Yeah, that's so true. And Dr. Chonillo, anything to add there?
No, I mean, I completely agree. I mean, I'll give you an example. Had done like yoga once, like in what is it, my late 20s. And it's definitely, a different type of exercise. Most people are like, oh, it's meditation, it's this. But it's like, no, building all of that, strength off of your own body is fantastic. For my own patients, I mean, I get a ton of female patients that they're like, listen, I'm having, I'm not even going through menopause yet. I'm having hot flashes. I'm having, for example, lots of anxiety or, depression. I'm losing my hair. A lot of the times, for example, these women come and they're like, what's going on? I don't have answers. And I'm like, well, have you talked to, you're seeing me now. So, I'll take, obviously the role of your primary care provider, but have you mentioned this to like your OB-GYN, things like that? And a lot of the times women will say, yes, I did mention it, but, I was kind of dismissed. And so I always encourage women because everybody's symptoms are a little bit, different. So for the most part, hot flashes are like kind of like a really like predominant one that we see in a lot of women. One of the less seen ones, for example, is like vaginal dryness. So I tell women it's always a little bit different for us to try to sort of seek a particular treatment plan for you. So, talk to us, tell us what your symptoms are. So that way, we can tell you the risks versus the benefits of us, recommending one thing, versus another. And that way, you can make an informed decision, with your primary care provider, your health provider regarding, what is sort of best going to help you as you go through this transition.
Yeah, you brought up a good point where members will come to me and say they've experienced certain things. They think they may be going through peri or menopause, and they bring up the mental component to it, and they are dismissed sometimes. And it's
Yes.
just so frustrating. So, yeah, I'm glad you brought that up.
Yeah, I mean,
Yeah.
as women, I think that overall, we are dismissed a lot, when it comes to these symptoms, when it comes to pain. And I always tell, my patients, I'm like, talk about it with somebody else, go see somebody else. There are answers out there. So just you got to keep looking sometimes.
Yeah, I love that. That's so important. That support. Hot flashes, real. Witching hour, waking up at 3 o'clock in the morning. Oh, yeah, the struggle is real. But anyways, Dr. Chonillo, as we discussed the impact of menopause and chronic conditions, and how can women advocate for themselves in the healthcare setting to ensure that those needs are being met, to your point, right? Getting the right support and feeling heard.
Yeah, so I mean, overall, like for example, like women will have like let's say a consult with me and they'll say, that I mentioned it to my OB-GYN, but they didn't really listen. So I say, okay, well, let's take a little bit, give me all of the details surrounding like what's going on. And then, for example, I'm like, there's nothing wrong with asking for the testing that's involved, that comes with it. So some of the things that we always, obviously have to look at is not just like, okay, let's say, for instance, like the hot flashes, because sometimes people have thyroid conditions that can lead, for instance, to hot flashes, and other symptoms that look similar to menopause. So I always, recommend for patients to get their thyroid checked. Younger women, because sometimes, for instance, with menopause, you skip your cycles or for a couple of months or your cycles become very irregular. So I say to them, okay, let's say a prolactin level. Just make sure that there's, nothing going on a little bit higher up. And then at that point in time, I'll say, okay, let's check, for instance, like hormone levels. So your FSH, LH, because we know, for instance, that the FSH tends to double and tends to rise as we get, closer to menopause. And then just get, like an estradiol level. So taking a look specifically at your estrogen levels to see essentially where you are. Granted, I do always caution women because I'm like, depending on where you are in your cycle, there, it's a little bit of variation. We might see something normal. And even if we do see something normal, that doesn't mean that you're not, going through it. But I think that all of this is part of, our role as healthcare providers to, educate people and bring, more awareness. And, my last sort of, recommendation is always listen. If somebody isn't, taking your, questions or concerns seriously, seek a second opinion. There are, a ton of providers out there now. So definitely, go see somebody else if you think you're not being heard.
Yeah, I love that. That's so important. And it goes back to that education, right? Educating yourself. You just mentioned a bunch of great, labs and tests that women can ask for to help advocate and figure out, what's going on.
Mhm.
Marissa, anything to add there?
We talked a lot about decreasing estrogen levels and cardiovascular risk for women. So getting that lipid panel drawn and knowing annually actually where you are is a good recommendation. And then after age 40, if you're a woman, you should be asking for a A1C check. We should be monitoring that because with this decrease in estrogen and the increase in the abdominal fat, that puts us at a higher risk for diabetes, or at least pre-diabetes. So having those two numbers and monitoring them might get a jump start on things. And again, like we mentioned, the vitamin D, if you're deficient in that, that might be some of the fatigue and the tiredness. So we could quickly get in and adjust those. Yeah.
Yeah.
The other thing I would just add is that bone health hasn't really been mentioned yet. And with the decrease in estrogen, our bones get more brittle. They get more porous, and you're at a higher risk of a fracture. So talking to your doctor about when's it appropriate? Am I high risk? Do I get a bone scan? Are you taking a calcium supplement? So just the bigger picture conversation for our full body health.
Love that.
Yeah, that's so important. I mean, it's even thinking about the specific labs to ask for, right? You go to your doctor year in, year out, and it's like your, basic metabolic panel and things like that. So just coming with those questions ready of, okay, I think I may be entering the stage of my life and working with your doctor for those labs. I think that's so helpful. But with that, thinking about it, we talked a lot about, this is a stage in life that is being more talked about. And I think this next question is really important because going through something like this alone can be isolating. Okay. So I really want to hear what role does community have in playing and managing these changes? More so, how can women support one another through shared experiences, particularly in managing menopause and even chronic conditions, diabetes, hypertension? Dr. Chonillo, let's see what your thoughts are.
Sure. So, I mean, nowadays, there's a lot of different, options for women. There's support groups, forums. I think that social media is a great way also for people to connect, just because you can connect with people like around the world, essentially. And then I think that, as women, we need to open up a little more sometimes, like, share essentially with the women in our own lives, like, our grandmothers, our mothers, our sisters, our friends. For example, like I had a friend recently who she was like, I'm going through all of these changes. She's like, I'm having hot flashes. And she even said to me, my doctor told me not to worry about it. And I looked over at her and she's like, I don't mean to talk to you about this, but I just, as a doctor, like, what do you think? And so I said to her, and I was like, you're going through perimenopause. And she's like, right? Right? And I'm like, yeah. And so we had essentially just a little bit of a sidebar discussion, at dinner. So I think that, helping to share with, people out there, bridging the gap a lot of the times with like social media, things like that. I think that it really, is a way for us to be able to connect, share our experiences, and maybe find somebody who's probably going through the same thing, and also helping a lot of the times that can help to guide us as to what are the next steps that we can do, what we should talk to our doctors about to see, overall, how can we, improve things for ourselves.
Yeah, exactly. It's so interesting too. I have some friends that just turned 40, and some of the things they're talking about, it's, they've never experienced this before. And them just having this open dialogue, got them to even talk to their doctors about what they were experiencing. Right. And they didn't really talk to anyone about it before. They're kind of going through it together right now. And it's just having that
Yeah.
support is so helpful. But that's awesome. Thanks, Dr. Chonillo. Marissa, I'm curious to hear what you have to say about that. I mean, you've mentioned a few podcasts that you've been checking out. So fill us in on what you have to say about the shared experiences and ways to get more support around menopause.
I think just being really open and sharing where you're at provides a ton of support. I have a group chat with several friends, and we will just randomly be like, what happened here? This happened last night. This is this morning. And so just having the support that you're not in it alone is huge. And you can laugh about it together. And for me, humor makes everything better. So I think just being willing to share your story and empowering other women. That's really what started this for me. I was not getting my own answers. I was sort of being dismissed when I went to my PCP that I loved and looking for other answers. I knew that this just wasn't, I was working harder, I was doing all the right things, and nothing was getting better. So, supporting women and listening to each other, I think, is the best thing we can do.
I love that.
Agree.
Right. And smiling about it through some of the difficult times too.
Yeah.
I love
Yeah.
that.
I love going through, Instagram and seeing some of the reels and
Yes.
just having a good laugh about it. You're just like, some of the women out there are like so funny. And you comment a little bit and you form like a little bit of a conversation there, because it's one of those things that it's like, oh yeah, I've been there. And it's just, it brings a little bit of humor to it, which I think is just so important as well.
It's so true.
Totally.
My mom's going to be so mad I'm saying this. I asked her, I was like, Mom, we're doing a talk on menopause and I want to hear straight from you. You've been through this period of your life. And she was like, well, I'm always cold. So the hot flashes were kind of nice. And I'm like, oh, that's not helpful. Maybe it is, but everyone, right? You said it's a very individualized experience, but.
Yeah. I'm glad everybody's talking about it. I know, Marissa, you have a group chat. Like my friends, my closest girlfriends and I were all, in our late 40s now. And we're talking about it. I never heard my mother and her friends talk about it. Right. So that's
Right.
so helpful. Right. It was like taboo kind of topic. I don't know. Except for I would see her just like turning red and sweating. And I'd be like, Mom, what is wrong with you?
Yeah. I know in my household, it was one of those things that everybody knew that it was happening, but nobody talked about it. You just kind of like side-eyed and moved away.
Danger.
Exactly.
Right. Right. We have some great questions that have come in. One of them is there a correlation between polycystic ovarian syndrome and perimenopause? This question comes from Jacqueline. Thanks for the question, Jacqueline. And I'll let Dr. Chonillo, go ahead and start.
Yeah, so actually, polycystic ovarian syndrome, they're not sure why, but as you get closer to menopause, that irregularity with your period, it actually gets better. And it's probably there's no actual clinical reason why it happens. That there's one of the things, once again, that there's not enough research on. But they do find that actually your periods get more regular the closer that you get to menopause when you have PCOS. They believe that it has to do with a little bit of the drop in estrogen, but there's no real great, research out there in terms of like what the actual answer to it is.
Okay. Wow. I
Yeah.
never even thought about the correlation. Another great question just came in. This is from Garnett. They are asking, are there different stages of menopause? Which is a great question. So who wants to answer that one?
I mean, I can. There are definitely different stages of menopause. So in general, menopause tends to occur about the age of 51. And we know that approximately, and this sort of varies because it could be anywhere between like about, essentially, a year before you have like your final menstrual period to up to like a decade, essentially, where you're sort of like in this like pre or like perimenopausal essentially state. Everybody's a little bit different. So it varies. On average, for example, the perimenopausal state though is about 4 years. So you really started like about 47 if we're looking at, for instance, an average age of 51 for menopause. And then of course, like Marissa had mentioned about, then you go through menopause, for about a year. And that's essentially a year where you no longer, have your cycle anymore. And then the year after that, then we essentially regard it as, post-menopause.
Okay. So it's like 3 cycles, to put it just simply, the peri-menopause and the post. Okay. That's helpful.
Very good. Another question, Marissa, I'm going to give this one to you. What would your advice be to women who are feeling very overwhelmed on their health journey, either due to menopause, chronic conditions, or mental health?
Come join us and talk to the coaches. We have a great team of coaches at Teladoc, and we're here for you. We are, some of us, on the journey ourselves, but we're really here to partner with you and provide support in whatever that looks like. So make your coaching happen. Yeah.
I love our coaches. Can't say enough about you guys. You guys are awesome.
Agreed. I have a ton of patients that have just amazing things to say about you all the time.
Well, that's a feel good. And it's so interesting too, right? Let's say, when you're in the chronic condition management, some of the things the coaches can cover, a lot of questions came up today about mental health support. So we can cover certain things, obviously nutrition, physical activity, sleep, stress management, but we can also work at certain things like sleep habits and coping mechanisms with stress. So, I mean, if you haven't checked out coaching, I definitely would recommend it. And it can be very helpful for more than just the chronic condition and the numbers.
Mhm.
So great question.
Absolutely. We've got another question. How can family members or caregivers support women who are in the menopause phase of life? I know we kind of touched on this, Dr. Chonillo. We talked a little bit about, hey, we know something's going on, but we're not going to talk about it. How would you offer some advice in that area?
So I guess the thing that I always say is that you maybe need a little bit of space right now, but I'm here essentially in case you need me. So I think that's sort of like really big and a great way essentially to support, people that may be going through this. Like, for example, my friend, I'm always like, hey, I'm here in case you have any other, questions, any concerns, anything that you may need. I wish that I had been a little bit older when my mother was going through, the transition herself, because that's the big thing that I would have said, like, hey, I'm here. Maybe you just need like a shoulder to cry on because it's a big change. So, women go through a lot of different emotions with it. Maybe you're having, a good day. Just let me know what you need. But I'll give you a little bit of space if you need that too.
100%. Yeah. Sometimes that's all we need, right? It's just a little space.
Yes. Yes, yes.
A little self-care too, right? Like always take time to do a little self-care. It's not selfish.
No, not at
No.
all.
No, I love that you said that because a question came in. We kind of piece answered it throughout the chat, but I do want to acknowledge it. In honor of World Mental Health Day, do you have any specific tips for someone who can take how to take care of your mental health during this phase? And I love that you said self-care. Actually, with the coaches, we have a learning library. If you guys haven't checked it out, members, check it out. It's awesome. And we have a 30-day self-care challenge. So it's not challenging. It's literally every single day how you can give time to yourself. And the way we word it, a lot of people, you're go, go, go. And now you're also dealing with peri and menopause. I mean, we need more than 24 hours in the day to deal with everything. But self care is honestly almost more important. To be as busy as we are and get everything done, we have to prioritize ourselves. So check out the learning library for some of those tips and tricks. But does anyone have anything to add with it being, World Mental Health Day? How to take care of mental health during this phase? Anything additional to add there?
I would say that, so I am a believer that everybody needs a little bit of therapy. So I always, encourage people to like use essentially like talk therapy or behavioral therapy as a first sort of way of, trying to, deal with everything that's going on, how to handle the stress. A lot of the times just being able to talk to somebody who's a third party and you being able to get everything out really kind of, helps you from a mental, health perspective. I always tell people like, some people think like, oh, doctors, we want to just give you medicine. My advice is always like, let's go the conservative route first. Let's do the talk therapy. We have, great mental health services here. And then, for instance, if it comes to the point that, you think you need a little more, you need a little bit of medication, then of course, you come and talk to us doctors. But I think the first step is always to, do the talk therapy, talk to someone, make sure that you have essentially a confidant that you can, always go to and say, hey, I'm having a bad day.
Yeah.
I
Very
would add
good.
to that. Sorry.
Yeah.
I would add to that
Oh,
filling
please.
up your own cup. Make a list of things that make you feel good about yourself or you enjoy doing and put that on the to-do list. Like make yourself part of the to-do list along with the dinner and the laundry and whatever else goes on it. You deserve to be there, and taking care of you essentially takes care of the rest of the family. So your mental health has to be taken care of. And I would also say one other thing, share this with your significant other. They may have no idea where you're at or what's going on. They just notice things are off, you're off, things are different, but they maybe don't want to approach you, the danger zone, or just don't even know where to start. So just even sharing a podcast that you've heard, say, hey, honey, take a listen. this is how I'm feeling if you don't have the words. There's lots of ways you can ask for help without being one-on-one.
Beautifully said. Lots of great tips, little pearls to walk away with. And as we wrap up, what are the key takeaways for women at any stage of life to prioritize their health, their wellness? And what final piece of advice would you give those that are navigating the?
Are you waiting for me?
Oh,
Yeah, I
I
think you
wasn't
cut out
sure.
there.
I
Sorry.
had like a little bit of a,
I think
a
I
little
was-
bit of a blank pause, and it ended, and I
Oh,
was like, I wasn't
no.
sure who.
Oh, sorry. I must have blipped out, but I said, Marissa, let's start with you, but let's
Okay.
hear from both of you.
I would say first, focus on reframing your thoughts. Focus on being strong, not thin, and talking about these changes with your friends, finding your support systems. And also focus on what you can control. So there are a lot of lifestyle factors we talked about today. Sleep, stress management, healthy eating, good exercise, move your body, and take care of your mental health. And really let that empower you as you're going through this journey. I would also say if you're feeling like you're not being heard by your physician, to look for a specialist near you. There are menopause certified physicians and nurse practitioners and PAs, and you can find those at www.menopause.org, because you deserve to be heard and have the conversation. And it might even be that, having the conversation around hormone replacement therapy and what that would look like for you.
Dr. Chonillo.
I mean, I completely agree, with Marissa. I always say this, when you go into an airplane and the flight attendant always tells you to put on your mask first before you help the person next to you. That is kind of, how we women essentially, need to operate, because we are a lot of the times advocate for, our husbands, our children, our parents, our siblings. And we sometimes forget to advocate for ourselves. So I think that, really sort of prioritizing our health by, going to see your, primary care doctor or your specialist at least, once a year to get those important checks. And then, like, Marissa said, just making sure that you're maintaining, a good diet, exercise, and that you ask essentially the right questions so that you can get answers, feel that like you're being heard, and then, obviously sharing all of that information with your support group, because you never know in sharing your experiences who else you might be helping as well.
Yeah. I mean, I have so much to take away from this. This has been such a beneficial talk, right? And I think it's interesting that we have, all walks of life, even in this meeting together, right? Some people haven't experienced it yet. Some people are actively going through it. So it's just been really, really helpful. And that being said, I did want to thank both of you for being here with us today. Marissa and Dr. Chonillo, you guys have been awesome. Thanks for joining us today.
Thank you. It's been a pleasure.
Yeah, this has been really good. I was like writing stuff down. I was like, okay, I know about the protein, but I need to do better with the fiber. And then add some magnesium as well. So really good information. Thank you both for being here. Really appreciate it. Thank you for our audience. And really quickly wanted to say, in celebration of Hispanic Latinx Heritage Month, we're proud to have Spanish speaking providers, coaches, and all of our content is available in Spanish end to end. Así que para la comunidad latina y hispana, los apoyamos. Thank you all who tuned in today. Be sure to come back and check us out for our next live event coming in 2025. It's hard to believe that we're moving into the next year soon. And so in the meantime, let's keep the conversation going on our social channels. Feel free to reach out with any topics that you'd like us to explore. We'd love to hear from you. And so until we meet again on Healthy Ever After, take care, everyone.